Hello and welcome back to the Stay Standing program. My name is Monique Kurdian. I'm the physiotherapist that designed this program. So today we're going to talk about managing urinary continence, and this is a topic that is close to all of us, or most of us, especially if we've had a child or if we've had a prostate removal. We've added an overview of all the Stay Standing program topics to slide 2. The core best practice falls prevention topics are listed in the left column. Managing continence is considered an extension topic to falls prevention because it's not currently included in the Cochrane database as a best practice falls prevention intervention. And that might be because there's just not enough good research on the subject. We think this topic is very relevant to falls prevention because there are many people who fall while rushing to the toilet. Many of our group participants have appreciated this presentation as it covers material that they may be curious about but have never had the opportunity to discuss. This presentation contains generalised information about managing your bladder and urinary continence, and it could be presented by a nurse continence advisor, continence physio, or other continence professional. If you're actually running a group yourself, you could also use the presentation run sheet as an assist, along with the many useful resources available on the Continence Foundation of Australia website. We support the work of the Continence Foundation of Australia and acknowledge the use of some of their images in this presentation. This presentation could be delivered any time after the first session relating to the material on balance. So this presentation considers the bladder and pelvic floor, urinary continence, and pelvic floor exercises to manage the bladder for urinary continence. Thinking about the incidence of incontinence in Australia, in 2010, Deloitte reported around 4.8 million people were living with incontinence, including people who live in the community and in residential aged care. They projected that by 2030, around 6.4 million people in Australia will be living with incontinence or have experienced it. According to the Australian Institute of Health and Welfare, in a 2006 report, around 13% of men and around 37% of women currently have incontinence in Australia. It affects 1 in 3 women who've ever had a baby, and it is very common following the removal of a man's prostate gland. And yet 70% of people who've experienced incontinence never seek advice or treatment. Moving on to slide 5 about aged care and incontinence, around 77% of people in residential aged care facilities have incontinence, and it's one of the 3 main reasons for admission, along with poor mobility and dementia. They estimate that about 40 to 60% of aged care residents wet the bed every night. The financial cost of incontinence in 2010 was estimated at $42.9 billion. In 2010, that equated to an overall cost of about $14,000 per person per year with incontinence. And as I said before, it's expected that over 6.4 million Australians of all ages will experience incontinence by 2030, which is about a quarter of our population. Slide 6 shows the location and bladder of the pelvic floor, and these images are from the Continence Foundation of Australia. The yellow circle represents the bladder. The bladder sits in the lower abdominal cavity connected to surrounding structures by various ligaments. The female uterus sits behind the bladder, and the male prostate gland sits below the bladder. The intestines are not shown in these images. The descending colon and anal opening is depicted in front of the tailbone or coccyx. The abdominal cavity is actually packed full with organs, and there is no empty space. The pelvic and abdominal contents are supported underneath by a group of muscles known as the pelvic floor, and that's shown in red in these images. The pelvic floor is a muscular hammock-like structure, stretching from the pubic bone at the front to the tailbone at the back. These muscles also work as part of the abdominal core muscle group. We will revisit the core muscles later in the presentation. There are a couple of interesting reasons why males are just biologically better equipped to control leakage of urine more effectively than women. The male pelvic floor has 2 openings, the urethra and the anus, whereas the woman's pelvic floor has 3 openings. Notice that the male's prostate gland is located underneath the bladder, whereas the female uterus sits behind and above the bladder. Males do not have the pressure of a uterus on their bladder. The male urethra is about 3 times as long as the female urethra, and the urethra is the tube from the bladder to the outside world. The principles of fluid mechanics tell us that the longer male urethra provides greater resistance to the flow of urine. The other advantage that the male pelvic floor has is that it never experiences stretching due to pregnancy or damage as sometimes occurs with childbirth. The female pelvic floor has 3 openings, as I mentioned before, the urethra, the vagina and the anus. As we know, females may experience pregnancy with or without vaginal delivery of a baby or babies. During pregnancy, the pelvic floor muscles support the additional weight of the growing baby pregnancy and during childbirth, it's not uncommon for the pelvic floor muscles to be damaged. The image on slide 7 is a model of the male bladder. We know that because the prostate gland is directly underneath it. The bladder is a hollow organ made of smooth muscle. Smooth muscle organs are controlled by the autonomic nervous system and hormones. Think of the autonomic nervous system as being in charge of our body's automatic functions that we don't even have to think about, like breathing and keeping our heart and our digestive systems going. The bladder has 3 openings, 2 holes near the top where the tubes called the ureters carry urine in from the kidneys, and an exit at the bottom for the tube called the urethra, and that goes to the outside world. The bladder is like a storage area for the urine until there's an appropriate time to empty. Slide 8 shows another image of the bladder above the pelvic floor muscles. The bladder is made of smooth muscle and does its job without our conscious control. The bladder is a reactive muscle and starts to squeeze in response to pressure, either from inside the bladder as it becomes full or outside the bladder when other things press on it. The sensation of the bladder trying to empty is what we feel as an urge. An urge can also be stimulated by the use of caffeine and alcohol, and when the urine is highly concentrated. It's usually safe to deny the first urge or two because the bladder can stretch up to 6 times its empty size and hold 300 to 600 millilitres. By the way, you should never deny the urge to empty the bowels, as this can lead to nerve damage and diverticulitis. The bladder and the pelvic floor have an interesting relationship. Normally, one of them has to relax while the other contracts. For urine to flow, the bladder contracts while the pelvic floor relaxes. To prevent urine leaking, the pelvic floor contracts while the bladder relaxes. Unlike the bladder, the pelvic floor muscles are skeletal muscles under voluntary control. During toilet training at a very young age, the pelvic floor and the bladder learn to cooperate with each other. As adults, toileting is such an automatic behaviour, and most of us don't even think about what our pelvic floor muscles are doing when we go to the toilet. So just reiterating, when the circumstances are right to urinate, the bladder contracts and the pelvic floor muscles have to relax to allow the normal flow of urine. If it's not the right time to urinate, the pelvic floor muscles are able to stop or inhibit the bladder from squeezing, and this ability is one of the keys to successful bladder control. The pelvic floor muscles need to be strong enough and coordinated enough to contract for 6 to 10 seconds, and that can be a long time when you're trying not to pee yourself. After 6 to 10 seconds, the bladder will reflexly relax and the urge to void can be deferred for the short term. Injury, disease, hormonal changes, and unhelpful toileting habits can disrupt effective bladder control. Just on a sideline, I'm often asked in these groups, how much fluid should I drink in a day? And this is controversial. Safe hydration is better for bladder function and heart health. People with poor bladder control may try to reduce the amount they drink, thinking that they won't need to urinate as frequently, but this is false reasoning because a higher concentration of urine triggers receptors in the bladder to empty more strongly. It also increases the risk of urinary tract infection. If we don't drink enough, we become dehydrated. Dehydration is dangerous for the heart as there's less blood volume and the heart has to work harder to circulate the blood. Dehydration also increases the risk of constipation. When the bowels are full, they can press forward on the bladder and trigger the urge more strongly to empty more frequently. Staying hydrated with a diet including plenty of fruit and vegetables. The chart shown on this slide, slide 9, is published by the United Kingdom's National Health Service. At the top, we see the colour of healthy urine. Next time you go to the toilet, check the colour of your urine. Just bear in mind that some medications and vitamin supplements can change the colour. For example, if you're taking vitamin B2, your urine may actually be a fluorescent yellow. Slide 10 shows a picture of the core muscles. It's often referred to as the abdominal cavity, but there's no empty space in the abdomen. The abdomen contains the liver, the kidneys, the spleen, the stomach, the small and the large intestines, and the reproductive organs, all in a relatively compact space. The abdomen has a moving roof, which is the diaphragm muscle. It has a back, sides, and floor, the pelvic floor, which together form the core group of muscles. As part of the core, the pelvic floor is involved with postural adjustments, stabilising the spine, and generating abdominal pressure. The pelvic floor also helps support organs, including the bladder, the bowel, and the female uterus. And it's also involved in sexual function for sensation and arousal. It also helps support the pregnant uterus in delivery of the baby. So, just to remind you that the bladder is under involuntary or automatic nervous system control. The pelvic floor muscles are different in that they can be controlled voluntarily. The bladder and the pelvic floor normally have a reciprocal relationship, meaning they work in opposite ways to allow us to urinate or to prevent unwanted leakage. In order to empty, the bladder muscle contracts or squeezes, and at the same time the pelvic floor muscles and sphincters around the openings have to relax so that fluid can escape. Sometimes we feel an involuntary urge from the bladder to void, but the time may not be right. By strongly contracting the pelvic floor for about 6 to 10 seconds, the involuntary urge can be switched off or delayed, and this is the key to bladder retraining. Slide 11 shows some common kinds of urinary incontinence. There are other kinds, but this presentation will only cover the urge, stress, and mixed incontinence. Urge incontinence, also known as latchkey incontinence, mainly involves the bladder and the autonomic nervous system. There's often a behavioural component of frequent toileting habits. Urgency, the sensation of needing to urinate urgently, may be triggered by learned habits. The bladder may begin to contract automatically when you put the key in the front door when you arrive home, or when you turn the tap on. The bladder's learned that the key in the door means it's toileting time. So allowing the bladder to empty frequently, or too frequently, sets up an unhelpful cycle and allows the bladder to shrink. The smaller bladder has an increased stretching sensation as it fills, resulting in the urge to empty more frequently for smaller amounts of urine stored. Retraining the bladder in the case of urge incontinence involves relearning bladder emptying habits and a lot of persistence. Some people also refer to urge incontinence as overactive bladder, and medications are available to reduce the urge sensation, and this would be something to discuss with your doctor. Stress incontinence accompanies weak pelvic floor muscles. It's also known as giggle incontinence, because sometimes when people giggle they leak. Mixed incontinence has features of both stress and urge incontinence, and it's very common, especially after childbirth. It can be improved with pelvic floor exercises and bladder retraining. Let's think about stress incontinence or pelvic floor weakness. So the weakened pelvic floor muscles allow urine to escape during coughing, laughing, sneezing, lifting, and high-impact exercise or jumping around, etc. Other symptoms include poor control of the bowels and incomplete emptying of bladder or bowels. Pelvic floor muscle exercises are relatively effective in preventing stress incontinence. So leakage can be harder to control if downward pressure is great or if the pelvic floor or the urethral sphincters are damaged. With a good pelvic floor contraction, after a while the bladder should relax and the sphincters close off to prevent urine from escaping. In some situations, the structures around the bladder, such as the ligaments which support the uterus and the bowel, may stretch, allowing organs to prolapse or shift and press down on the bladder. And this downward pressure can lead to the overactive bladder feeling. Risk factors for prolapse include situations where the downward pressure on the uterus, and therefore the bladder, is greater than the supporting pressure of the pelvic floor. And this might occur in pregnancy with vaginal delivery, delivering a large baby, repeated heavy lifting, chronic coughing, so this is where smokers have to be careful, constipation or straining during bowel movements, so this relates to the importance of diet and hydration, obesity, general pelvic floor muscle weakness. So why do pelvic floor muscle exercises work? Well, because these muscles are like other voluntary muscles, just like your arm or your leg muscles, and with practice you can train them to work more effectively. Contracting the pelvic floor muscles will control the bladder urge signals and tighten the sphincters to prevent leakage. And in case you're wondering what that picture is on slide 14, it's an aerial image of a dam. Slide 15, how to contract the pelvic floor. So if you're unsure whether your technique is effective, consult a continence professional. That will involve an internal examination, and a lot of people feel a bit shy about that, but the professional is just that, a professional, and they will tell you if you're actually using your muscles effectively. Otherwise, you can try it at home by yourself, and even in the group, we use techniques where we stand up and we say, if it's to a guy, lift your testicles without using your hands. Or imagine you're trying not to pass wind, or use the elevator technique. It's also important to try and breathe normally while practicing these techniques. Slide 16 is about pelvic floor exercise techniques again. We recommend that you practice the exercises in standing, which is probably the position you'll be in when you need to control your bladder the most. Also, to switch off unnecessary muscle groups, you can turn your feet slightly inwards, sort of pigeon-toed, and this position stops the buttocks from contracting and better isolates the pelvic floor. You can also do this in public and get feedback from your core group of muscles by placing your fingertips just inside the bones of your pelvic brim. So that's just inside, it's kind of in line with your belly button. There's like a pelvic brim, and then if you drop just forwards towards your belly button, put your 2 fingertips there where the blue arrow is pointing on this slide. When you contract your pelvic floor, you'll feel a subtle tension under your fingertips. Slide 17, pelvic floor muscle exercise dosage. So if you're trying to retrain your pelvic floor muscles, start with 6 fast squeeze and lifts. And you could include this in your daily routine so that you don't forget to do it. So something that you're already doing on a regular basis, at least 3 to 6 times a day, such as toileting. But if you do practice this around that time, don't do the exercises while you're actually on the toilet peeing. That's training the bladder to do something incorrectly. Do it perhaps when you're washing your hands at the sink afterwards, or when you've completely finished toileting. Now, to train the bladder and pelvic floor muscle endurance, try keeping the pelvic floor muscles tight, squeezed tight for 6 to 10 seconds. And this is to help switch off that bladder emptying reflex. Once you're good at these exercises, you could try increasing your pelvic floor muscle strength by maintaining a contraction during a cough or a lift. And just try this maybe only 3 times a day. This could also help improve spinal stability and pain management for the spine. Now, if you think you're beyond help from pelvic floor exercises, you're probably mistaken. However, a continence nurse advisor can assist with information about continence aids and appliances. The Continence Foundation of Australia has some great resources, including a free helpline, some online explainer videos, and flyers on just about every topic of continence. And they'll also be able to direct you to the subsidies you can claim. There are national schemes which provide subsidies for people who have permanent and severe loss of bladder or bowel function, and you have to have certain eligibility criteria to access them. So one of those is the Continence Aids Payment Scheme, known as CAPS, and the annual subsidy amount in 2018 and 19 was $596.60. And there's also the DVA Rehabilitation Appliances Program, known as RAPS, and there are eligibility criteria for that as well. So they are having a gold card or a white card for accepted conditions, not receiving high-level aged care, and also an assessment by a health professional and so forth. And the subsidy amounts vary according to the client. Slide 21 says lifestyle tips for staying continent. So we can do other things apart from pelvic floor exercises to help ourselves stay continent and manage our bladder. That includes empty the bowels regularly and avoid constipation by drinking plenty of fluids, eating high fibre foods such as fruit and vegetables, exercising regularly and using your core muscles, quit smoking, lose weight, avoid repetitive heavy lifting, and reduce caffeine and alcohol intake, as these strongly act as bladder irritants. So now let's review what we've talked about in this presentation. We've considered the relationship between the bladder and the pelvic floor, the common kinds of incontinence, how pelvic floor exercises help, how to do pelvic floor exercises, although I do suggest if you want help with that you seek an exercise professional, and who to contact when you need more information. I suggest if you're running a group that you discuss correct toilet posture, and that includes knees being higher than hips, lean forward, elbows on knees, and allowing the abdomen to bulge with a straight spine. And you could also discuss medications which may affect continence, such as anticholinergics and Botox and tricyclic antidepressants and so forth. You can find out more about those also online at bladderbowel.gov.au, continence.org.au, and the National Continence Helpline. Thank you for attending to this presentation. I look forward to speaking with you in the next one.